An accidental discovery that revolutionized the field of medicine. This video is gonna sound a little biological, as today we are gonna talk about penicillin. Widely regarded as the world's first antibiotic, penicillin marks its 92nd anniversary from its invention. It was first discovered in the year 1928, and from then, experiments and studies on it continued for many years. Penicillin was the first medicine that was effective against bacterial infections caused by staphylococci and streptococci. The discovery of penicillin was more of an accident rather than a planned experimental study. Sir Alexander Fleming, a Scottish microbiologist, is credited with the discovery of penicillin. Fleming worked as a physician in the St. Mary's Hospital in London, which is now a part of the Imperial College, where he was working with the influenza virus. Often regarded as a careless technician, Fleming was surprised upon his return from his 2-week-long vacation. A fungus, Penicillium notatum, had contaminated a culture plate of Staphylococcus bacteria, which he left uncovered. Upon examination, he found that the fungus prevented the growth of bacteria in the culture. Following this, he published an article that stated the antibacterial property of penicillin in the year 1929. Fleming continued his research until the year 1931 and published his findings on journals. But he lost hope to continue his experiments as he couldn't extract large quantities of the penicillin compound for further clinical experiments. He sent the penicillin mold to anyone who requested him, hoping that someone would isolate the compound for medical purposes. During the year 1940, two scientists, Ernest Chain and Howard Florey from Oxford University, intrigued by the findings of Fleming, found an effective method to extract penicillin at large quantities. The initial testing of the drug proved effective against many bacterial infections caused by gram-positive bacteria. Soon they were able to produce penicillin drugs in large amounts along with the American pharmaceutical companies. Large quantities of the drug were produced and shipped to the front line to treat the soldiers during the World War II. Penicillin proved superior to treat bacterial infections during the war than its counterparts, the sulfur drugs, which originated from Germany. Penicillin saved the lives of thousands of soldiers who were most likely to die due to infections caused by wounds and small cuts. One study states that, during the World War I, the majority of the deaths were caused not by heavy shells or bombing, but by infections caused by small wounds. Many scientists at the Oxford University were cautious about not sending these penicillin molds to German scientists, with which they could extract the penicillin drug. Those Germans laid their hands on penicillin only after 1942 and couldn't achieve full-scale production of the drug. This eventually created a setback for the Germans in the war. During the first 5 months of 1943, only 400 million units of penicillin were available. But by the end of World War II, more than 650 billion units of penicillin were manufactured by the pharmaceutical companies in the US. Penicillin became a lifesaver drug, not only for soldiers, but also for civilians, which cured pneumonia, strep throat, and many other deadly diseases. Chain and Florey were awarded the Nobel Prize in Physiology or Medicine in the year 1945, which they shared along with Fleming for their invaluable discovery and work. Penicillin became the widely used antibiotics in the upcoming years. Over the years, many types of bacteria have developed resistance for penicillin because of its extensive usage. Yet, it is still being used to treat some bacterial infections. To date, penicillin has become the most widely used antibiotic in the world. The discovery of penicillin will be never forgotten from the pages of history. I hope it was informative. Thank you.